Hi, we're really excited to offer you a re-recorded training from the May 16th All-Staff AOK Network meeting, where we offered an overview of Thread 3 services and supports for Phase 2, the system assessment. I want to encourage folks to skip ahead, go to the sections that you know that you need a little bit of booster on, and more than anything else, go to AOK Box and look at the meeting plans, print those out, be sure to read them, highlight them, and look at all of the supporting materials and resources that are available to you. So starting here, we just wanted to highlight some of the most important pieces of information. One, this whole section here is all about the conversation. So we're going to be asking folks to go out and ask questions, gather insights from system actors in their communities. We want to hear from people who are experiencing the targeted problem, those who are providing services related to the targeted problem, those who support at the local level, and those who are decision makers as well. So big picture, we want a lot of answers to a lot of these questions from a lot of people. All the quotes and insights that you gather, especially from meeting 2, are the receipt of your conversation. This is qualitative data that's helping to tell a story. This is a reverse root cause analysis where we're asking people, we're listening, and we're going to theme and organize that data. This is going to help us count the number of people who said what, how many times, and all of those quotes, all that great information that people are sharing. We're asking folks to put that in the Excel spreadsheet, the Harvest qualitative data spreadsheet, where you put the quotes and then tag them by system condition. So this process is very similar to the Child and Family Outcomes Assessment, Phase 1. It takes place in 4 steps, where first we're assessing the system itself. We've done that through Thread 1, centering families to understand equity and our families in the system, how that's going well or not so well related to the targeted problem. Thread 2, system actors, who is there related to our targeted problem? Who do we need to engage? Thread 3 is taking all of the services and supports and programs and starting to understand what's there and what's not there, where it's located, who do we know, who do we not know, to really help us understand that targeted problem itself. Thread 4 will be all about information and referral, where we're looking at who's being connected, how are we connecting to each other or not. And then we'll process that data, and we'll make some decisions as part 2 of our assessment, where we can then move forward to design some strategies. So this is again similar to the outcomes, where we collect data, and it's pretty messy, where in Phase 1 we looked at numbers. In Phase 2, we're looking at pieces of information that people are sharing with us. So those are the quotes, that's that qualitative data. And we're going to start to hear patterns. We're going to start to recognize things that people are saying, and we code that through the system conditions themselves. So as we're coding it, we're making sense of it. We make it less messy, and we confer with our partners and say, hey, do we agree on that sorting? Does that make sense to you? And then from there, we prioritize using a methodology to get a smaller set of data. That smaller set of data is what we use to design strategies to help to address the issues that are coming up related to that targeted problem. Our prioritization system is going to be very similar to what we did in the Child and Family Outcomes Assessment, where we have 5 criteria. So the first one is magnitude, and this is where that spreadsheet really becomes so important. So how many times are those system conditions being raised, by how many people, and how frequently? We're going to look at some patterns to understand what are the connections between the system conditions that we see raised most often. And then these last 3, kind of that ready, willing, and able. So is it going to strengthen our network? Will it duplicate works of others? Are these system conditions meaningful to our AOK network? Could we build a shared agenda? Is it feasible? Is it realistic to get work done on this right now? Are there solutions and resources available, including expertise or willingness to build expertise? And is it powerful? Is it possible to improve these system conditions? The set of system conditions, when they're put together, they can shift very powerfully. Our habits and routines can make a lot of change. So we want to understand that as well. So for our system assessment, the purpose of this thread is really to understand the range of services, programs, and supports available in the community that are related to the outcomes in the targeted problem. Of course, we center families and equity by discussing who and who is not benefiting from services, programs, and supports, by identifying the different system issues that are contributing to the targeted problem. So through this work, we build a list and we become familiar with what's there. So our range of services, supports, programs, opportunities that are available to the families and children who are experiencing the targeted problem. We look at that list and then we want to identify services and supports that are missing from the list, ones that are no longer available, and some that are not existent in the community at all. We want to understand the conditions, those issues related to this list of services and supports that could be contributing to the targeted problem. And by doing this, it helps us to understand barriers that could be contributing to the targeted problem. What's getting in the way? What's contributing to this? How did we get here? We can also see the strengths in our system that we can use to help create system improvement. So by the end of this session, we're hoping that folks will be ready to share the differences between meeting 1 and meeting 2. So the shortcut is meeting 1 is build a list and talk about it. Meeting 2 is look at that list and gather some insights. So you build a list of services and supports. You can describe system conditions to your partners, host a conversation to really help gather insights about those system conditions, and then you'll be able to sort and categorize the quotes by the condition itself. So really want you to understand and be comfortable with those system conditions. So meeting 1, again, create a list of services and supports, and you have the option to create a visual map to help display that data. In that meeting, you discuss this draft list, you can refine it, revise it, and then you'll finalize it. In meeting 2, we gather insights from diverse perspectives. So we want to talk about the system conditions that could be contributing to the targeted problem, as well as strengths of what may be going well. And then get out there and be creative. Get some quotes from many people this summer. Then we have you make sense of the data. So you can have some variation on how you get out there. You could bring a list or map to smaller meetings, such as staff meetings that are hosted by your partner organizations, through one-on-ones, parent events, and so forth. So for meeting 1, what we really want you to do for your homework is to prepare. So read the services and supports meeting materials for Plan 1 that are available in AOK Box. So in there, you're going to find a meeting plan, you'll find sample agenda, process, tools, and other ways to help you organize your meeting. So as a pre-meeting, a small group, your data work group, for example, you build a list of services and supports. That could be a targeted list, which is focused just on the targeted problem, or a full list, which would be all the services and supports. You can use Iris or other directories to be able to do that. You have the option to visualize this list. You can use Google Maps, or you can use GIS if your public health department or your organization happens to have that type of a service. We have a template that's in Box to help you make that list. So you basically take the list from your system actors spreadsheet, save as new and update it, or you could use this template. Okay, so we want to make it as easy as possible. Then you have your meeting, you facilitate a group discussion, and that process is the jigsaw process. What that is small groups work together and then come together like one big puzzle, and then they discuss what they've had talked about at their table. And then post-meeting, you debrief, reflect to capture insights, summarize key discussion questions in part 1, complete part 2, and if people have some quotes, some things to say, some qualitative insights that are related to system conditions, we want to make sure that you capture those, put those quotes into the Excel Harvest document, and then tag those by system condition. We want to make sure that everything that's said gets captured. So this jigsaw process, there's an example for this. So it's a way to break up the content of the meeting in small groups, each of which focuses on a particular part of the puzzle. The facilitation method allows for deeper conversation and exploration of the parts of the service analysis by small groups. The activity will end with each group sharing the highlights from their discussion with the whole group, and then you get a full group debrief. Ideally, groups are similar in terms of the number of people per group and the number of services that they are reviewing. So be sure to go into AOK Box and take a look at that and then practice with your small group before you bring that to the large full AOK network meeting. So again, here's the template on the left side. That's what that looks like. You can find that in AOK Box. And then on the right side is a sample of what a map looks like that I made from Lake County, Illinois. One of the things that's nice about being able to visualize the data in a map is it can show you where there are lots of services in some sections of the county or community and where there aren't so many services. And you can look at other maps to help kind of overlay the data. So are there pockets of poverty that don't have any services at all? Are there pockets of wealth and resources that have lots of services? Are there areas that are kind of emerging high need areas? So in this map here, we have a lot of services in Waukegan, where the public health department is located. Along the North Shore, there's a lot of services and supports in kind of that wealthier community and near the military base. Then you get into the heart of Lake County, and you'll see some services and supports, again, kind of in a wealthier area. There's kind of an emerging immigrant population, and there's some lower income families that are right in the center where there aren't very many services and supports. So by looking at a couple of maps, that'll help you understand what's going on in the community and really spur some good, rich conversation. So meeting 2, after you've made your list, what we want you to do is actually share that list with other people, and then through a set of guided questions, you facilitate a conversation that looks at that list, looks at the targeted problem, and says, hey, now what's going on? So your pre-meeting, your pre-homework is to really become familiar with those system condition descriptions and questions. And we have examples of those in AOK Box that we went over in our in-person meeting. So you can kind of practice, get your head around it. And then in your in-person meeting, you want to facilitate a couple of different types of discussions to capture insights. So we have worksheets that are available for you to guide the conversation. Plus we have all of those same questions put into slides. You can print those out, you can post them around the room like in a carousel format. But the idea is to help people take what they've been learning and start talking about it. Start sharing their insights, their wisdoms, their experiences about what they think is really contributing to the targeted problem. And then after that, in our post meeting, we debrief, reflect to capture insights, summarize those discussion questions, complete parts 1 and 2. And what that does is that really helps you to remember what happened in the meeting. And then most important is to enter any quotes that people shared into the qualitative data tab of that Excel harvest document. And then tag those so that we can count them and start to analyze and process the patterns that are starting to emerge related to the barriers and obstacles that might be contributing to the targeted problem. Okay, so speaking of the targeted problem, we also want you to print out the table. Make sure that as you're hosting these conversations, people are focused on the targeted problem. So you could print it as a vision, which is given here as an example, that will help people think about what could be and what are the obstacles that are getting in the way of us achieving that vision of what could be. When you present it as a targeted problem, that focuses participants on what is not going so well, what is contributing to the targeted problem. Either way, we want folks to be focused on the problem itself, the outcomes that we've unpacked, and keep in mind that the focus for our system assessment is really in that dark blue early child success outcome part of the table. Shifting our system here will have a great impact on our child impact outcomes. So the child impact, the yellow area, is really our long-term vision, our aspiration. We want things like more children to be safe, reduced rates of child abuse and neglect. We want more people ready for kindergarten, meeting benchmarks for communication and literacy or mathematics and problem solving. But what is our system issue that is contributing to that outcome? So we want to make sure that we're looking at that dark blue level as we're starting to have our conversations with folks. That light blue, that's the family early success outcomes. And those are usually at the population level. So that might include housing security, food security, education level, poverty. You're encouraged to build subject matter expertise and joint committees in that area and really start to invite those partners to the table to really round out what's going on in your AOK network related to this targeted problem. So overall, for all of the outcomes, we want to remind you to get to know people, get to understand the services and connections that are related to the outcomes in your targeted problem. Okay, here's a sample question that sets up meeting 1. And here's what the worksheet looks like to help to focus the conversation as we're looking at that list of services and supports connected to the targeted problem. So 2 high-level questions here are, why do some children and families benefit from services and supports and others do not? And in what ways does our system of services and supports contribute to the targeted problem? Why is this happening and what's going well? So those are broad, those are big level questions. When you ask big questions, you're going to get a lot of insights from folks, and then you can tag their quotes by the system condition. Alternately, you'll see that there's some colors on the table on the right-hand side. Those are question prompts that are written directly related to a system condition. So that's an option as well. So if I'm asking a question about mindsets, then the answers are going to kind of already fall into that mindsets bucket. Saves me a step on the categorizing and sorting side of the work on kind of the back end. But sometimes these questions can sound a little awkward, so we're going to leave it up to you to customize, look at the worksheet, and build out a plan that works best for you. Now let's talk about those system conditions. So I know that in some of our one-on-ones we've been able to go over these, but we'll just do a refresher. All right, so the system assessment is focusing on system conditions, which are categories to understand what is not going well related to our targeted problem. By understanding these categories, we can be more powerful to understand and improve our local system. Some of these conditions have a more powerful influence on the system than others, and patterns are going to emerge. We'll start to notice that there's connections among some of these. So you might see that we might have a connection issue and a power issue and a mindset issue, or we might have a resources issue and a regulation issue and a components issue. So you'll start to see that there's patterns and there's kind of clusters that will start to form. So just to walk through each one of these, what we want to kind of keep in mind as a very big picture is that our system is made up of people, and people have habits and routines. And so what we're going to be understanding is that things like mindsets, our attitudes, values, beliefs, and perceptions are important because they change the behavior that then impacts children and families. So if my mindset is that I have an attitude that women are the ones who enroll their children in childcare, my practice, my habit might then be to not create materials to engage fathers or stepfathers or uncles or other male caregivers in the early childhood education process. So mindsets, attitudes, values, and beliefs that influence behavior. We want to think about that. Goals, objectives, outcomes, targets, mission. Sometimes organizations will have benchmarks to measure certain things that then take them in a direction that does not serve or it contributes to the targeted problem. Power, that would be whose voice is being used, whose voice is elevated or amplified in decision making. So decisions, decision-making processes, power, influence, family voice. So how are families included in decision making? So the example I sometimes give for this one would be, a Child Find event is being hosted to offer developmental screenings to families, and the families don't show up to the event. So the person who coordinated that event might feel frustrated and say, parents don't want to screen their children, that's why they didn't come. But I would ask, did that planner ask parents what time is the right time to host that event? Where is a good location? So how is parent voice included in designing solutions to improve our system? Regulations is the next one. So regulations could be formal or informal. policy. So sometimes it's state level policy, sometimes it's school, the school itself has a policy. Sometimes there's different procedures, just the ways that we do things. There's regulations, there's eligibility requirements, daily practices, ways of working that can contribute to the targeted problem. It's kind of how we got here, what's getting in the way of our vision. Connections, that's relationships, referrals, coordination between each other, how we talk to each other. Do we talk to each other? Are we making referrals? Are we forgetting to? Are we working in silos? Are we collaborating? Are we aligning? Are we aligning from, say, pre-K to kindergarten? Is our curriculum aligned? Is what we're learning our expectations? So how are we connecting? How are we coordinating? Components, those are the pieces and parts of the system. So where programs are located, for example. Are there programs that are where eligibility is safe for families living at 100% of the federal poverty limit? Are they located in a place where it's mostly working families? And then are programs for working families located where where mostly low-income families live? So sometimes Head Starts are located in sections of town where there's a lot of working families, and vice versa. The CCAP programs, child care assistance programs, are located where mostly Head Start eligible families live. So that's a component of how our system is designed that doesn't work well for families. Okay. And then resources, think about this one as your bucket of what do I know? So knowledge, skill, capacity. What do we know as a community, as a system about, say, postpartum depression, mental health first aid? What do we know about home visiting programs? What do we know about substance use and abuse? What do we know about nutrition? What do we know about teen pregnancy and where they can access food and nutrition? So some of our communities actually have a lot of food deserts in that area, so that's a resources issue. So if we want our teen parents to get nutrition and to feed their child and their other children healthy foods, how do we get that if there aren't any resources in our community? So that's a system level issue. An example of solutions are having farmers markets. I know in Adams County they had tried this for a period where they had worked with WIC to get the SNAP benefits available for people to use at farmers markets. Okay, so you kind of close the gaps. So a lot of these system conditions are gaps to access. What we can do as a system is to understand this and to close those gaps and make it easier for families to access our system. All right, so remember that meeting 2 is all about the conversation. So that's when you're getting out and you're talking to all these different kinds of people. You ask questions and then you code and tag what they're saying by the condition itself. And one of the best ways to do this is to get out of the building, to have fun, connect with others in the community. We want you to ask people to share their ideas. What you can do is you can take the questions that are on the worksheets and you can work with parents or work with your partners to modify those questions to help make them easier to understand. And then go out there, take the list of services and supports, take your map, take your targeted problem, take your questions. Go out there and start to find out what's going on. Learn from the people so that you can design a better system that includes input from many, many different voices. So there's different ways that you can gather insights. So we have this worksheet that I talked about, and then there's also a root cause analysis template that's from the folks from Able Change. So it's kind of a cheat sheet. You could have these as handouts in the meeting, one or the other, maybe even both. People can fill it out, they can answer the questions, and they can start to let you know their insights on what's contributing to the targeted problem. You can do a meeting in many different ways, so you have a lot of options, and these are really all laid out in your meeting plans. You can have a 60-minute meeting, 90-minute, you can do it over 2 months, 1 question a week, get out and about, just try, experiment, see what's working or not working. And really, just the other tip that's super important is that as we gather as much detail, or as we gather information, we want to get as much detail as possible. So as partners are sharing insights on a system issue, without any detail, it's going to be hard to know what's really happening. So here's an example of a system issue without a lot of detail. So parents do not know how to complete the application for services. So if I'm an outsider, I just read that. I'm not really sure what that means. So if I wasn't there with the parent, I'm not going to understand. So we want to say, tell me more about that. So another way with more detail is this. Caregivers who speak English as a second language do not know how to complete the eligibility application for ABC services because the language is written at too high of a reading level. So a shortcut is just to say, tell me more about that, and make sure you have the what, the when, who, where, why, those 5 whys. And in your AOK box folder on this, you're actually going to find a cheat sheet for getting actionable information, and that has some good clarifying questions and some good examples to help you out. Here's some more tips for success and those post-meeting actions. So remember, we want you to compile and summarize the system issues from any meeting, from chart paper, from surveys, worksheets, anything that you're doing to get insights. If you have any kind of +1 start issues where people repeated these ideas, make sure you note that, okay? You can enter any of those summaries in part 1 and part 2, and be sure to code and sort that information by each system condition. Okay. And then these are slides for guided discussions. So this last set here is really for you to explore. You can print these materials out. I have them also available to you in Spanish, and my little note is to make sure that you preview that Spanish translation so that it aligns with the Spanish that's spoken in your community. I just used an AI program to translate that, so I don't trust it. I would trust you to take a look at it and make sure that it's done right. Here's an example where I have all of the slides themselves in here for you, and I'm going to make this available to you not as a PDF, but as the PowerPoint itself so that you can see the notes. And in the notes, there's different wording of these same questions to help you go a little bit deeper. But you can print these out, put them on the wall like a walking gallery. That's another way to host this meeting and to really get people's insights about each of these issues. So we have one for mindsets, one for goals, power, regulations, connections. And so what you'll see is on the right side is that list giving examples, and then on the left is the question itself.